meeting of today. That will have a very important invitees, our guest, who is the national president, Dr. Folefac Edmond. I think most of you must have seen him when he appeared on Gaza Media, where he was calling all other bashes to come together to form. So today he will be talking to us about cancer awareness. That is his specialty. He's an oncologist, opening prayer, and Madam Rita, can you lead us a word of prayer?
Let us pray. Heavenly Father, we thank you for the gift of life. We thank you for gathering us all today, this evening, morning, wherever we are. We beg on your guidance and support in whatever discussions we are going to carry forth on this medium, that let it go far and impact so many lives. We thank you for the knowledge, the wisdom and understanding, and that we continue to be of favor to each and every one of us. We bless your holy name in Jesus Christ. We pray, amen.
Yeah, I give it over to you.
Good day, everyone. My name is Gilead, your Gaza Media anchor, and you're welcome to this very special platform, Gaza University, we call it, which is a platform of knowledge where we get together to acquire knowledge, not with the aim of having certificates as per se, but for our own self-development. Like we rightly said, like we rightly heard from the director, we are going to be having a health topic today for our presentation, cancer awareness, to be presented by Dr. Edmond Folefac. Doctor, you're welcome to the program today.
Thank you, Madam Moderator. And once again, thank all of you, the wonderful batch of 1989. And first, I would not start without really appreciating all what you do. And really, it's a testament to the saying that the young are really the smarter ones. And I think that you people have just demonstrated it, and you're making us very, very proud. And I think if you continue this way, our alma mater, not just the alumni, the association, but we'll do great things for ourselves as an alma mater. For our alma mater, and then for our individual selves as alumni. And
thank you so much.
Yeah.
Thank you so much, Doctor. Before I come back to you, I would like to call on those who are just logging on to Gaza University for the first time, that it is very important that when I give the opportunity to our guest speaker to do his presentation, it's very important that all of us remain absolutely silent, because any noise from anyone's background will cause the camera to turn from him to focus on you, which is not what we want. So if you have any noise by chance in your background, it's very important for you to mute yourself. There is a mute button below the screen. Just touch your screen and you will see an icon that looks like a microphone. You tap on it and it will mute you. As well as if you are not properly dressed for the meeting, it's important that you can equally turn off your video. And after the presentation, we are going to give an opportunity to whoever wants to give maybe a reaction or a contribution or even ask questions to do so. And this will solely be done by the moderator. So we plead on everyone to wait for their turn to speak and make sure you respect the time limit too that they give you to speak. So we call on our doctor to stay put after his presentation, because he will have to receive reactions from our audience. So without wasting any much of our time, I would like to call on Dr. Edmond to go ahead with his presentation. Doctor, you have the microphone.
Again, Madam Moderator, thank you very much. This is a topic that is very dear to my heart. And so when the director and it contacted me about this opportunity to have this conversation this evening with you folks, I really wanted to dwell on this and have this evening to talk about. This is the next tsunami here that is actually on its way to engulf Africa. Unfortunately, many people in Africa don't not really taking cancer as seriously as we would like it to be. And and as we go along, you'll probably find out some of the reasons why. And one of the other things that actually happens in Africa is, because of our deep-rooted belief that diseases are actually caused by evil spirits, there is this almost very, very easy way, lazy way to really blame every disease, including cancer that comes in various forms, on some evil spirit. And that really also further accentuate the problem that cancer itself is called, has been defined by some emperor of all maladies, meaning the king of all diseases. And when I define it to you, and then we start talking about it, you will find out the reason why. When people use the term cancer, they use it so loosely. And there is a reason why they use it that way. But we in oncology realize that cancer actually defines a group of diseases, probably more than 100 diseases and counting. But they all share one fundamental, a few fundamental features, probably about 5 of them. We agree that all cancers share those 5 fundamental features. The first one is that cancer cells, unlike normal regular cells, would grow, they can divide indefinitely, and which we usually say the cancer cells are immortal. And a normal body cell would divide probably about 50 times and then it would stop. And that's the limit that nature has put on the body, and probably why we age. But cancer cells, if given the right conditions, can grow indefinitely, they can divide indefinitely. The other thing that happens is normal cells, they will also, the normal tissues would grow only a few centimeters and stop growing. And that's because they need blood supply, to feed them to continue to grow. Remember that all your body cells actually need to get food and dump their waste in blood. And this blood are carried to the body by blood vessels. And so normal tissues don't usually grow their own blood vessels, but cancer cells do. And so because they do that, they can grow to enormous sizes because they then begin to get nutrition, from the rest of the from the body, from the organism in which they are afflicting. The third thing that distinguishes cancer cells from normal cells is that the cancer cells can produce their own so-called growth factors. In the body, every cell would have signals that allow it to grow, and those signals comes in the form of chemicals that we call growth factors. Eventually, when the cell reaches a certain size, then the body sends another group of signals called anti-growth factors, which stop the cells from growing. But cancer cells do not respect this. They grow their own signals, their own growth factors, and then they are insensitive to the anti-growth factors. And then lastly, cancer cells, unlike normal cells, can actually leave the area where the start and then travel, which we call metastasis, and then colonize other areas. So in a way, which is one of the most devastating attributes of cancers, and this is quite different from normal cells. You don't see the ear growing on the chest or the lung growing in the bladder or vice versa, because when the embryo starts growing, at a certain, the cells start dividing, then they start differentiating. To get to a certain point, those cells that commit to becoming, forming the ear, they can only form the ear. Those that commit to form the nose, they can only form the nose. Those that commit to form the lung, they can only form the lungs. And then when they grow, they don't actually travel from that spot to another area, no matter how close those organs may be. Cancer cells are the only cells in the body that actually would have this inherent ability where they would grow and then figure out a way to get into the blood and then travel to other place and then get to that place, seed that place, and then grow and overtake the normal tissues of that body. And that's actually how most cancer cells kill patients anyway, their victims anyway. And, you know, in a way, I think about cancer cells as I would explain it to my patients or to every lay person. I would say, think about cancer, think about like an insurgency in the country, because cancer cells are your non-normal body cells. And so the key question that we haven't yet been able to figure out is what triggers cancer cells to start growing in the first place? What makes a normal cell to just sit and then decide and say, hey, from this day on, I'm going to behave like a juvenile delinquent. I'm not going to listen to nobody. I'm just going to behave like an insurgent, take on the establishment. Unlike an insurgency where the reason why the insurgency always start is probably the aim is always to take over control of a certain area. We don't know why cancer cells start growing in the first place, but they behave like an insurgency in that they attack the main body, which is your body. And that's why sometimes cancer becomes very, very challenging to treat, because some of the treatments that we would use, since their cancer cells are actually normal body cells that decide to, not listen to instructions of the body, it means that they share so many attributes with the normal body cells. And so most of the treatments that we would design to treat cancer, it means they would also affect the normal body. The normal body cells, and people may get a lot of side effects. That's why you hear people getting side effects from chemotherapy and all the like. Now, the question then becomes, how do we categorize cancer? I remember many of you would have read Animal Farms, right? George Orwell's Animal Farms. And for simplicity, the animals, when they decided to take over manure farms, they just decided and very simplistically and said, everything that walks on 2 is an enemy and everything that walks on 4 is a friend. And so by walking on 4, they were defining all animals. And then by walking on 2, they were referring to the human. But, you could be that simplistic. But amongst all those humans that were in manure farms, there were the pigs, there were the horses, there were the donkey, and so on and so forth. So when we say cancer, you think about the same analogy. Cancer can refer to those animals in there, but many of them, but you start teasing it out. You have different cancers that behave differently, but they share those 5 properties that I talked to you about. And for simplicity, traditionally, we have actually then divided cancer into the anatomic organs that they originate from. So therefore, you would hear things like breast cancer because it originates from the breast. Colon cancer, it originates from the colon. Prostate cancer, it originates from the prostate. And lung cancer, it originates from the lung, and so on and so forth. But that's a very simplistic view of cancer. As we become more and more, we've developed better and better tools to help us categorize this disease. It's become more apparent to us that some of these cancers, even though they may originate from different anatomic positions, they may have very similar behavior. So there is a biologic classification that is beyond the scope of what me and you will discuss today. Now, if we don't know the reason why a cell finally develops to become a cancer cell, do we at least know what risk factors will predispose people, to developing cancer cells? The answer is yes. Age is by far the single biggest risk factor, which is the reason why probably more than 60% of the cancers are actually diagnosed amongst people 65 years and older, which we call the geriatric age population. The older people get, the more likely that they could develop cancer. Another risk factor is genetics. We know for a fact that there are some people who are burdened with bad genes. Instead of winning the good lottery, they just win the bad lottery. And so these genes are like, your genes are part of your little snippets of your DNA, which is like the cookbook of everything that makes you and me. And snippets of, so a gene would define that particular segment of the DNA that can actually, make give a certain threat, a manifestation of a certain threat. Like say somebody with red hair, for instance, there will be a gene that makes their hair red, and so on and so forth. So there are some of these genes that actually predispose some families to cancer. And those genes probably constitute maybe about 10% of all cancers. And there are quite a few that some of you may be aware of. The big one that is out there that many people in the news, especially when it comes to breast cancer, will be something that they call the BRCA gene. And I'll come back to that in a minute. So those genes, but then the other thing that predispose people to cancer is smoking. Probably that is one of the biggest risk factors. 9 out of every 10 lung cancers in this part of the world that I am in, because by smoking. In some areas of the world, in Asia, the numbers are a little bit different. But smoking doesn't only restrict to causing lung cancer. It can also cause throat cancer, cause bladder cancer, cause, name the cancer, and some form of smoking may be related to it. And each cigarette that people smoke, why is cigarette so bad? Cigarette contain well over 7,000 chemicals. And amongst those 7,000 chemicals are probably more than hundreds of 150, probably several hundreds of them that actually are carcinogenic. Carcinogenic meaning that they can turn a normal cell into a cancerous cell. The other thing, the other risk factor is infection, chronic infection. And this is much more relevant for, especially in the underdeveloped world, places like Africa, where we have things like hepatitis B, hepatitis C, H. pylori, and HPV, which we'll come back again to, and so on and so forth. So there are all of these infections that together may be responsible for about 20% of all cancers as well. Another risk factor is the environmental pollution. Many of you might have heard about Chernobyl in your history lesson, where there was this atomic bomb that was dropped there and stuff. So these places with those, some of the radiation, the amount of radiation that came through with this, the Chernobyl was more of an accident in the radiation factory. But either there or even in Hiroshima and all those places, we know these places have a preponderance number of cancers that are more than the average place. And we know smoke also contains a lot of carcinogens and so on and so forth. So there are other things that, like some of the dye that is used in some of the dye industries and so on and so forth. So these things all are responsible for a small part of the cancers that we find. Other things to think about would be obesity. People being overweight. When you carry more than your ideal body weight, a lot of these things, the excess weight, which is mostly in many cases fat, actually generates a whole lot of chemicals that are very deleterious to your body, including predisposing people to cancer. the other thing that people should know is sedentary lifestyle. If you're not exercising, again, you're not able to get rid of your toxins and then a lot of other health benefits that come with exercise that you lose, including the ability to protect yourself against cancer. So here, alcohol consumption, actually, especially in Africa, it's again another one. People who drink in excess, they are more likely to develop cancers. The specific, some more cancers are more common among drinkers. Things like liver cancer, for instance, that changes the liver from a very soft, texture that it has to something more like beets that will cause cirrhosis and eventually develop to cancer, or other additional form of cancers that people with alcohol would have, things like pancreatic cancer as well, that really just damage the pancreas, and in some cases always turn it to cancer. There have actually been a lot of data also suggesting that this actually alcohol consumption may increase the risk of breast cancer and so on. So there are these risk factors that we know that cause cancer. And then the question is, if we know all of these risk factors, what can we then really do to prevent cancer? First, let's talk about categorize the risk factors into those that you can modify and those that you cannot modify. In medicine, when we talk about modifiable risk factors, we're talking about risk factors that you have a role that is, you can change their course, you can change their trajectory, either by trying to limit your exposure to them, or actually even maybe finding a way to completely do certain things that can reduce your risk of developing breast cancer, even if you were exposed to it. So the amongst those modifiable risk factors, of course, we talked about weight, and then we talk about diet. Let's talk about diet and ask yourself, what kind of diet do you need to eat to be able to stay healthy and also prevent yourself from getting cancer? The answer is fruits, vegetables are much better, than, so let me back up a little bit. I have my little food pyramid. The gold at the top there is all fruits, vegetable, plant-based, whole grain. And then the silver is around fish, especially oily fish. And then the bronze is chicken or white meat generally. And then at the bottom of the food chain is sugary stuff, processed food for those of us that are in the West. And of course, generally red meat. So there is that is the quality piece of it. The quantity piece of it is eating more than your fair share. If I go back, and then many of you may read your books of faith. I think at the start of the prayer, at the start of this session, you prayed. And I think I'm going to send up my own first question. Whoever answers that question, once we're done, I would send $100 to the moderator for that person's charity, the charity of that person's choice. If none of you answer that question, then all of you here would contribute to a charity of my choice. So the question is, who was the first person to conduct an experiment on food to show the beneficial effect of food? So I leave it at that. And so let's continue, and we'll come back to that. So exercise, how much exercise is enough exercise? So by experts' recommendation would say that if you can do moderately intense exercise, 3 times a week, meaning about an hour of exercise 3 times a week, you are fine. Or 30 minutes of exercise daily, you are fine. But I should say that either way, you should aim to do more, not less. And the other thing about the exercise is that when you're doing the exercise, they used to be taught probably that running was better than walking and so on, but there is more evidence now that if you do just brisk walking, you probably are fine as much as somebody who is doing just the running and other things that you may do. Some of you may hear about the 10,000 steps rule. You may buy your little Fitbits, that little watch that would count your number of steps and make sure that you get about 10,000 steps in per day. But aim to get more, not less. And then in terms of your body weight, how do you know that you have an ideal body weight? The calculations mostly people talk about, the most commonly used measure is something that we call the body mass index, or BMI. And that is, if you take your weight and then you divide it by your height, your weight in convert your weight in kilograms. For those of you who are here in America, convert it into kilograms. The rest of the world already measure things in kilograms. And then you divide it by your the square of your height in meters. So if your height is 1.5 meters, you said 1.5 square. Then you divide your weight, which is 70 kilograms by the product of that. You will get your BMI. So ideally, most people, the ideal BMI is probably somewhere around 18.5 to about 24.5. And then too low is not good. Too high is not that good. So in the obese category, we start thinking about a BMI of 30 and above. And that's where you don't really want to go. But there is a caveat for women, since most of their weight may be around their hip, is not really as bad as most men. One of the things I've been really struggling, who develop their belly more, their weight more in their belly. One of the things that has actually been my dream, and I would have a few of you help me with this, wherever you are, is I see a lot of our young African men, when they get here, they become young early, they get married, looking so handsome, so trimmed, and then eventually the women get pregnant and then they deliver the babies. Then later on the men get pregnant, and they're kind of like, what happened? So you start seeing people moving with soccer balls in their within their shirt and stuff like that. I'm like, what's going on? We need to change that. Those are terrible habits that we are imbibing in the West, which are not good. Now go back to, so that's about weight. We'll talk about weight, we've talked about nutrition. Let's talk about screening in cancer. Which are the cancers that we really have screening, that we have enough literature to recommend screening for. One is colon cancer, and the colon cancer, you screen it, we can screen it through the use of something we call a colonoscopy, which every man or woman age 50 and above should have. They can use something that we call a fecal blood test, which is buying these tiny little chips and then putting a little bit of your stool on it and then seeing if there is blood. One of the common symptom of colon cancer is when people start passing blood in their stool. You can use it and then you can go see an expert. They can then do a colonoscopy. And if they find cancer, then they can take it out. So those are probably about the two things that we do for colon cancer. There are other things, but for the sake of this conversation, just remember those two. For breast cancer, the screening recommendation would be for something that we call a mammogram, which essentially is some form of a powerful X-ray, so to speak. which looks at the breast. Then, depending on the characteristics of the breast, it can pinpoint whether a breast, the spot in the breast is cancerous or not. The recommendations would be for most women between the ages of 50 to some will say 69, some will say 74, to get a mammogram. Again, the frequency is a little bit of a debate, but at least probably every 2 years is fine. Some people may say every year. Women between the ages of 40 to 49, if you are not in the high risk category, which we'll talk about a little bit, then there is not really enough evidence to suggest that screening at that age would help you. Under the age of 40, it's probably not even recommended except in very special circumstances. So those people who are at very high risk that may need more screening, or starting screening at an earlier age are people with a family history of breast cancer, meaning if your mother, your sister, your aunt have had breast cancer, especially the younger, the age at which they had breast cancer, the more likely that you should start at a younger age to screen. Some people would have this genetic mutation that we talked about, which we call the BRCA gene mutation, which initially stood for breast cancer gene, but it's not really a breast cancer gene per se. The other things may include some race. It's not some Jewish races, as we call them Ashkenazi Jews, but for you, it's not really that an important issue. But because mammograms are not really that prevalent, in Africa, where most of you or your families may be, the question then becomes, what can we do to actually detect these diseases early? The answer is, probably a breast self-examination may be, a very crude substitute, not really an exact substitute, not even close, but at least the breast self-exam can tell you if there is a lump in your breast. If you start feeling something abnormal, then it can allow you to present early to a clinician who can then make other recommendations and recommend other screening. The other thing that we should know, the other kind of cancer that we can screen, would be things like prostate cancer. A little bit, the data there is a little bit, for some people, may be controversial, but for those of us who do this for a living, is not. And that is for the people using PSA screening in most men, from the recommendation would probably be from the age of 55 to about 70. But we know that prostate cancer, just like breast cancer in many Africans, occur at a younger age. And because it occurs at a younger age, I usually would advise my African Americans or friends or brothers to start screening a little bit early, maybe at the age of 50. But if you do screen for PSA, it's a test that is a little bit misused because it's misunderstood. And so if you want to screen for it, you have to have a conversation with a doctor and let them tell you what a PSA, an abnormal PSA means, because an abnormal PSA doesn't necessarily mean that you have cancer. They are numbers, and there are other tests that would need to be followed in order to make sure that you are being managed the right way. And of course, if in doubt, you can always reach out to me. Same thing with the breast, with mammography. It's not always that if you have an abnormal mammogram, then direct means therefore that you have breast cancer. But that is the start. The other thing that I want to switch a little bit and talk about, it's cervical cancer, I should say, which with pap smear or testing for a virus that causes cancer, the cervical cancer, can really help a lot. There is a virus that is called the human papilloma virus, which actually may be responsible for as many as 90% of all cervical cancers. And that is a very, very prevalent virus amongst young people, amongst young women, boys and girls. But this virus doesn't only cause cancer, cervical cancer. It can cause anogenital warts cancers, and then some head and neck cancers, and penile cancer as well. So for women, you can do a pap smear or testing for that for these particular virus, which are all your clinician can start doing it, and people can start doing that as early as 21, and do it if you're doing a pap smear by itself, they can do it every 3 years. If you're doing a pap smear along with the viral screen, they can do it every 5 years. But the cervical cancer, frankly, this is a disease that if we all collaborate, then that disease would almost be extinct in the near future. And because there is now a vaccine, for that targets this particular viruses that caused cervical cancer. And that is called the HPV virus. And there are 3 forms of it. But, usually we like to give it to young girls and boys anywhere from the ages of 11, 12 to about 15 or preferably between the ages of 11, 12 to about 13, you start it. But sometimes some people can get it as early as 9, and then the recommendation, you can get it. Initially, we started by saying you can get it up to the age of 26, but now we recognize that people can actually even get it even up to the age of 45 and so on. So, but how many doses of the vaccine you give depends on the age that you start. If you're starting at a younger age, 2 doses are enough. If you have to start at an older age, you probably need about 3 doses of those vaccine. And it is a very, very, very effective vaccine against the common viruses that cause some of these cancers. The other thing that I would have to mention, on the line of vaccine would be vaccines against hepatitis B and hepatitis C. These vaccines need to be taken by preferably, women who of childbearing ages, and then all of us who did not have that vaccine as in childhood. So we need to get it in childhood. Need to get it if you don't have. If you didn't get it as a childhood, it's something to really try to get. And one of the things about hepatitis B and hepatitis C is sometimes you find a young man, or maybe because these are like some of these viruses are transmitted sexually. You have a baby that is born and then acquire the virus through the birth canal. 20, 30 years later, these people die of liver cancer, which is really very young, but that's because they acquired the virus very early through the birth canal. So if otherwise, I think these are the things that I wanted to really share with you people in terms of how you can just the little tiny nuts and bolts of cancer in a very global, simplistic way. Each one of these topics, we can pick it up and then, kind of digest it for about an hour or 2 or 6 hours, depending on what we want to talk about. So if you heard nothing, know that after here, you will get out and start exercising. You would eat healthy. For those of you who drink, you will stop drinking and drink either very moderately. If you ever have smoked, or if you are still smoking, quit smoking. For those of you who with young children, let them get their vaccines, including the vaccines for HPV and for hepatitis and so on. And then and if you do have a parent or some relative or who then has anything that resembles cancer, please call me. One of the things that you just want to know, what you want to realize is that the earlier we diagnose a disease, the better the outcome, the better we can treat that disease, and the cheaper it is to treat that disease. But ultimately, the treatment of the disease, the best way to treat a disease is, first of all, to not have it. And to not have it means you have to prevent it. So, and I will urge all of you to be champions in carrying this message around, making sure that our people understand. And cancer is not the result of some witches or witchcraft. Cancer is something that is like other disease caused by some of the factors we know, some we don't, but nonetheless, they are diseases like any other disease. I will end by just saying, I have been to many funerals in America. And one of the things I hope that you guys would also carry along is the fact that I have seen people die of cancer, even here in America. And the family, then you're burying, it's almost like you have two tragedies. The one tragedy is that the family has lost a loved one. The second tragedy is that they start accusing other family members for having been at having bewitched somebody, in order to inflict that person with the disease. I mean, we're in 2020, right? Coming to 2021. So we should do better. We should and think better. Like I don't see anybody who is sitting here. I've seen many of you from Cameroon, some from Europe. Nobody says that technology like this is witchcraft. So why does it have to be disease that we then ascribe it to witchcraft, meaning especially when we're out here where we can see all of these things with our own eyes and see that it's not only affecting us, it's affecting other people, and then they look at it and treat it differently. So cancer is not supposed to be cured in the church or in some witch doctor's backyard. Get to the hospital, get the experts, and if you want to pray, please pray, be a man of faith, be a woman of faith. I don't have a problem with it, but make sure that you realize that cancer is a disease like others. Thank you very much. And I would sit back and answer questions, but don't think I've not forgotten my question. When you answer when I answer your question, then we'll answer mine.
Wow, that was a very powerful presentation, Doctor. Please, let's give him a very well done clap. I think that was powerful. We thank you so much.